required by law as a form of research. It is not an accurate form of testing, and companies should look towards alternative researches. Her three secondary claims are that animal testing is not required by law, animal testing is not an accurate form of research, and alternatives that are more effective, and less cost-effective are available. So for her first claim that animal testing is not required by law, I found that there's not really an argument here because on the FDA website, they already stated, they updated it in 2006 that it is not required by law. For the secondary claim, animal testing is not an accurate form of research. She provides three examples of different tests, and for her source, the website it came from was Buzzle.com, and the author was Gainer Parade, and she doesn't seem to have a scientific background. She mastered in English, and she even put in her bio in the website that her passion is writing and linguistics. My counterclaim to her second point within that is that she says testing response of an animal is different to human reactions, and I argue that testing response of an animal is closed, because according to another different article that she used, using animals for testing, pros versus cons, which came from About Animal Testing website, it says that researchers do recognize limitations and differences, but the testing is done on animals because they are thought to be closest match and best one with regards to applying this data to humans. According to another website, AltWeb, which they say that they don't argue for or against, but they just provide information to scientists and industry and the public, that animals are biologically similar to humans, and they're susceptible to the same health problems as we are. Much of what we know about the immune system has come from studies with mice, and much of what we know about the cardiovascular system has come from studies with dogs. Many heart surgery techniques were studied first in dogs before being used in people. She then goes on to talk about the lethal dosage test, also known as LD50, and said it's not accurate and results only in 65% accuracy. But there also doesn't seem to be an argument here because I think her information is outdated, so it's no longer relevant, because I found on About.com Animal Rights Guide article, What is the LD50 test, updated in 2010, written by Doris Lynn, who got her bachelor's in applied biological science and is also an animal rights attorney, says that because of the controversy, the LD50 test is not used as much now as it was in the 1980s and 1990s. And according to the National Institute of Health, the Consumer Product Safety Commission strongly discourages the use of the test, while the EPA and FDA do not require it. Next, she talks about the rodent cancer bioassay test and says that it is not accurate, has a false positive rate of more than 70%. And my counterclaim is that it is accurate, and I found it on another source she provided, pros versus con article. And animal testing allows researchers to initially gauge the safety of drugs prior to commencing human trials, and this reduces the risk of harm and saves human lives. That's why we use the test, and according to rodent biopsy evaluation draft interagency coordinating committee on the validation of alternate methods, written in 2008, that these studies provide accurate information about dose and duration of exposure, and it then concludes that laboratory animal tests remain the best tool for detecting potential human health hazards of all kinds, including cancer. The last form of testing that she tells us about is the Drace test, which tests chemicals on the eyes of rabbits. And she says this is inaccurate, but my counterclaim is that it is necessary to prevent human harm in testing, and it's also been refined and reduced according to GARI, which is Group for the Education of Animal-Related Issues. Researchers are looking for potential causes to cancer, birth defects, and developmental abnormalities. Furthermore, the techniques of this test have been reduced and refined, so they use a lower dosage, and they also use anesthetics to ease the pain. And even many companies no longer use this test, so it can also be seen as no longer relevant. Next, she gives us this case in May 1990 about the recall of medicine that was tested on animals, and this source is also kind of old. It's 10 years old, and it's also one case, so it could be insufficient compared to the many other medicines that have been approved and used through the testing of animals. Again, in the article Pros versus Cons, many medical treatments have been made possible by animal testing, including cancer, HIV drugs, insulin, antibiotics, vaccines, and many more. And then for her last claim, alternatives that are more accurate and less cost-effective are available. She supports it with some can also refrain from animal testing completely by using non-toxic organic ingredients. One type of animal testing, such as cancer tests, can reach expenses of $3 million. My counterclaim to this is that the gains in human health and well-being outweigh the costs and expenses of animal testing, like what we've seen with the examples that I said before. Second, non-animal testing can be considered, such as computer mathematical models, cell tissue cultures, and corneas from eye banks. My counterclaim to this is alternate methods can be used, but they can't fully replace the use of animals, and may never do so. Neither cells grown outside of body nor computer programs can predict the complex interactions that occur in an entire living system. My second counterclaim is that through animal experimentation, we got many medical treatments, techniques, and technologies from them. According to Altweb, again, the development of immunization against such diseases as polio, diphtheria, measles, rubella, pertussis, and hepatitis all involve research on animals, as did with insulin and the study of diabetes, the development of organ transplantation, hip replacement, chemotherapy, cardiac pacemakers, coronary bypass surgery, and ongoing efforts to understand and treat AIDS and Alzheimer's disease, and more. Another technique she provides is that biotechnology, which has allowed scientists to study the breakdown of chemicals in a human body through a test tube, a 3D imitation liver, also use virtual reality systems that can accurately test the results from the human patient simulators. So my counterclaim to this is that animals are a better research subject. Many species have relatively shorter life cycles, and so we can observe through their entire lifespan or through generations. And furthermore, scientists can control certain aspects of the animal's environment more easily than they could with humans. And lastly, she says that the NIH funds the most, around $5 billion goes towards animal testing. And my reasoning against this is that although the monetary cost of animal testing is high, the resulting benefit proves to be high as well. So my counterclaim is that research on animals is beneficial to humans, and secondly, it's also beneficial to animals. I think I got this from Altweb as well. To develop vaccines and treatments and cures for diseases, we use animals for this. And we also use them to ensure the safety of our products so they won't burn, blind, or kill us. And they also help students, especially doctors, veterinarians, and so on, to learn their way around the body. Also, it could be beneficial to animals as well. Animal research has played a role in many advances in veterinary medicine, including the development of vaccines for rabies, parvovirus, and distemper. Various devices and treatments developed through animal research, as I said before, and they have been used in veterinary as well as human medicine. Some animal research is even aimed at developing alternatives to animal use so that fewer animals could be used in the future. So even though alternatives may be used, I don't believe that they can replace animal testing altogether. All in all, her evidence was problematic due to potential biases. She got her sources provided by PETA, which knows against animal testing, and a lot of the articles had loaded words and language, and also some of the sources were outdated. So in conclusion, animal testing, although it is not required by law, I believe it's an accurate form of testing, and although companies could use alternative forms, it can't be replaced altogether. Thank you.